Please join me in welcoming Veterans Affairs Secretary, Dr. David Shulkin.
Great. Well, good morning, everybody, and welcome to Washington. It's great to see so many of you here early in the morning. President Brooks, thank you for your leadership, doing a great job, and I'm really looking forward to spending a little bit of time with you this morning. My goal is to give you an update on what we're doing here in Washington to improve the lives of veterans. And as you know, as we just saw in that video, it's so important that we work synergistically together to make sure that we are improving the lives of our country's veterans. I always start with why we do what we do in the Department of Veteran Affairs, and we like to say that that charge comes from President Lincoln 2 weeks before his second inaugural address, where he gave us these words that we still live by every day, to care for him who have borne the battle. And of course, today we modernize that to be more inclusive, particularly of women, that are the fastest growing demographics of veterans in the country. So we really are charged with to care for those who have borne the battle. And this past year has been a really important year for us to make some accomplishments with our veterans. We've had 11 major pieces of legislation go through Congress and signed by the President. Almost everything that we do is done in a bipartisan way, as it should be for veterans. But just to talk about some of these accomplishments, we've established a new caregiver and survivor and family advisory group to figure out ways that we can all work together to support our veterans. And we're very fortunate that Senator Elizabeth Dole has agreed to chair that. We've worked to make sure that we have extensive and expanded funding for community care so that veterans who are not able to get all the care that they need in their local VAs are able to go out into your communities and get care in the private sector. The President just signed an executive order in January that will make sure that 100% of service members who leave the military will receive a mental health benefit. What you may not know is that today only 40% of those who leave the military are eligible for mental health services in the VA. And soon that will be 100% thanks to the President's leadership on this. We've been working with so many of you in the counties to figure out ways to improve our benefits process. And we're making some really good changes there that I'll describe shortly. And finally, we've changed our appeals process, the first time since the 1930s, with new legislation that we just got through this year to make us be able to do this in a more timely way. And I thought your County Matters video really expressed it so well. We can't do this work from Washington. We need to be working in the communities, and we need to be working with all of you, and that's why I appreciate the time with you. In August of 2015, we established our first Community Veterans Experience Board to make sure that we are actively talking and dialoguing with members of the community, not only at the local government level, but also not-for-profit groups and others that care a lot about improving services locally to veterans. We have 130 of these now around the country. They all have different names because they all take different flavors. In San Diego, it's called One VA Community Advocacy Board. In St. Paul, Minnesota, it's Beyond the Yellow Ribbon Steering Committee. In Ann Arbor, it's the Veterans Community Action Group. Orlando, Mission United. Alabama, Operation and Trust. So you get the sense, and hopefully, if you're not tied in to a local Community Veteran Experience Board, that's something that you might want to look into when you get back home. If you don't have a local CVEB already, this Community Veteran Experience Board, let us know if there's an interest in developing one. So we went from 0 to 130 in the last 2.5 years, and we believe that there are still many others that we want to try to establish with your help. A lot of work is done in the local community. Our state veteran homes, our county services are really where many of our veterans get their services, and we do know that, and we know how important that is. We also know that our veterans are getting older. As our veterans age, and they're living in your communities, their medical needs and their benefit needs go up as they get more complex issues that they need our help with, so that this demand is only going to grow as our veteran population gets older. As you know, the average age of the Vietnam veteran is about 67 years old now. And as those veterans continue to get older, their demands on all of us are going to be even greater. So we have a challenge that's somewhat predictable that we can model out ahead, and we know that's going to require closer collaboration. So what I wanted to share with you are the 5 priorities for the Department of Veteran Affairs, so that you can see what we're working on, where our focus and our priorities are, and hopefully look for some synergies between the work that you're doing to support veterans in your community. The first of these priorities is to give our veterans greater choice about how they get care and how they get services such as benefits. And this is just like any other organization or business that has to be customer focused. And sometimes when you're a big government organization, you lose track of that. So we're putting this as our top priority to make sure that veterans are involved in how and where they want to get their care. We have a program called Choice that allows veterans to get care in their community, but today it's limited using administrative rules that you have to live more than 40 miles away from where a primary care doctor is located or wait 30 days or more for care. And we're working with Congress now to eliminate those rules and to build in instead clinical decisions so that any veteran who needs care gets the care in the best setting possible, whether it's in the VA or it's out in the community. And this is something that we hope to be able to accomplish in the next couple months working with Congress and the President. If we do this, and I believe that we will, this means that we will add benefits for our veterans that include walk-in services like urgent services in their community. So they'll be able to get routine labs and x-rays rather than having to drive sometimes many, many miles just to come into a VA to get that. That if the VA is not offering the quality of care that it should in that community, that veterans won't be stuck there. They'll have a choice to get care in the community. And any time that there's a clinical need, you shouldn't have to wait 30 days. If you need to get care at a certain time, we want you to be able to get care in a setting that's appropriate right away. So that's really what we're working towards on improving veterans' choice. The second of the 5 priorities is to modernize the VA system. As many of you know who have visited VAs in your local communities, there's tremendous variation, but about 60% of our facilities are more than 50 years old. And when you are operating them 365 days a week, that really begins to start wearing thin. And so we are looking at ways to be able to modernize this system because we believe our veterans deserve the very best. One of those decisions that I made recently was to modernize our electronic health record and go with the same electronic record that the Department of Defense uses. It only makes sense to me that you should be able to, from the time you enlist till the end of life, if you choose to get your care within the same system, be able to have the same electronic record. And so we're working hard to implement that system. That will save the government billions of dollars, but more importantly, be able to have all this information that's so necessary in one place instead of having systems that struggle to talk to each other. Part of modernization is making sure that we act like a system and take the best management practices. That's what groups like NACo do. You share practices among counties. And so we've actually written a book called The Best Care Everywhere, which takes the best practices in the VA system and begins to share them with VAs, but also for groups outside the VA who can learn from lessons and management practices that the VA is doing currently. And so this is part of an attempt to modernize our system with the best management practices. With our facilities, this is actually our Palo Alto facility, one of our rooms. They're all single rooms. Family members can stay overnight. This is about as nice aesthetic a room as you would find anywhere in the private sector, and we're aiming for this type of standard across the VA as we begin to modernize our facilities as well. One of the ways that we're doing that is getting out of our underutilized and vacant buildings. We've have 1,200 of these, and we are disposing of these almost every week. And the new infrastructure bill that the President's working to get done allows the VA to reinvest those resources back into current VA facilities that veterans are using, and it's one of our strategies for modernizing the VA. The third of the fifth priorities is to improve the timeliness of our services. And I think all of us remember back in 2014 when the VA wait time crisis happened in Phoenix, Arizona, where we just weren't taking care of our veterans in a timely way. Today, we have same-day services in every one of our VA facilities in primary care and mental health. 96% of all of our appointments are completed within 30 days, 85% within 7 days, and 22% on a same-day basis. One of the ways that we are tracking this is we now publicly post all of our wait times on the VA website. It's updated every 2 weeks. We are the only health system in the entire country that publicly posts its wait times. So your veterans can see how long they'll wait for care and be able to make choices about whether they want to go to that facility or whether they want to travel and go to a facility with lower wait times. What most people don't realize is that VA wait times overall are actually shorter than what you find in the private sector. We have a lot of attention focused on us, sometimes negative attention, but overall our wait times are about 40% better, 11.3 days shorter than the private sector. Now that doesn't mean everywhere in the country that we're better than the private sector. We struggle in areas where there's a lack of healthcare professionals, particularly in rural areas, just like the private sector. But overall, most people don't realize that the VA has improved its performance significantly since 2014. One of the ways we're doing this is with telehealth. No other system in the country is using telehealth the way the VA does. We spend over $1 billion a year. About 730,000 veterans get their care through telehealth. I still am a practicing internist, and from my office here in Washington, I take care of patients in Grants Pass, Oregon. I've never been to Grants Pass, but that's where I see my patients. You can see I'm showing the President my patient with my clinical team in Grants Pass as we're taking care of him, this time from the White House, to show the President how we're using this type of technology. We're also improving the timeliness of our benefits and our claims. Not too long ago, we had 611,000 claims greater than 125 days. Today, that would be less than 75,000, and by the end of this year, it will be less than 50,000. We're implementing a new system called decision-ready claims where we can get an answer back to a veteran in 30 days. And we're working with our veteran service organizations and many of you to try to get veterans to understand this is an elective process that they can use to get faster decisions. I mentioned our appeals modernization, a law that we got changed since last updated in the 1930s. Because of that, we're beginning to process many more appeals. We've also added additional staff. We're on track to do 81,000 decisions in our Board of Veteran Appeals this year. That's up from 60,000 last year. We have 450,000 claims in backlog, so we have a lot of work to do. And again, we're using this change in the law to help us speed up that process because we don't believe veterans should be waiting so long to get decisions on appeals. The fourth of the 5 priorities is to do business differently, to focus our resources at VA on things that matter most to veterans. You can't be everything to everyone because then you end up just being mediocre. We believe we need to be world-class. No one should be better at certain services that matter most to veterans, things like traumatic brain injury, post-traumatic stress, prosthetics, orthotics, blind rehabilitation, the environmental hazards of war, things that really veterans need the VA for because they don't exist in that depth in the private sector. And so we are focusing our resources on issues like that. The way which we're tracking how we're doing, if it is world-class, we publish our quality. It's available publicly. You can look at your local VA compared to your local hospitals and other providers in the community. And we're going to track this, whether it shows that we're doing better, worse, or about the same, because we have to get to be world-class in the types of services that I've talked about. In things that matter a lot to veterans, we have been focusing our resources, things like hepatitis C. As you know, this is a higher prevalence in the veteran population, hepatitis C, and fortunately, now we have drugs that have 95% cure rates. So we have gone out and we've targeted all veterans who are serologically positive with hepatitis C. We had 160,000 veterans who were positive about a year and a half ago. We will soon be at 20,000 and on our way to eliminating hepatitis C from the entire veteran population. There will be no other system in the country that has done that, has put its efforts to call in and reach out to do that. Thank you. And finally, the fifth priority, the last one, but it's the only clinical priority that I talk about, is something that we can certainly use your help on because it's just an alarming statistic, and that is the number of veteran suicides and what we can do together to reduce that. 20 veterans a day take their life through suicide. Hard to imagine. You know that veterans have a higher rate of suicide than the general population, but as you know, working in your communities, this is an American public health crisis. This is alarming in all populations, and it relates to the opioid crisis and the overdoses that I know that many of your communities are plagued with. But in veterans, if you take a look at this slide, we know what saves lives. While all U.S. veterans, if you were receiving care in the VA system, mental health care, over the last 15 years, your rate of suicide went up 5.4%. That's not good, it went up. But look what happened if you were a veteran not receiving care in the VA system over those same 15 years. It went up 38.4%. Take a look at the very last line with female veterans. If you were receiving care over the last 15 years as a female veteran in VA, your rate of suicide went down by 2.6%. But if you were outside of the VA, it went up 81.6%. So we know getting people help saves lives. We need your help in being able to connect people that are isolated, hopelessness, depressed, not having access to services, to be able to connect them with care, either in the VA system or if they choose in your communities with hospitals, providers, not-for-profit groups who are there to be able to help. Because of that, we've launched a national campaign to reach out to get this message out there that we want veterans to be able to be connected with the help that they need. It's called the Be There campaign. Tom Hanks is our national spokesperson for it. BeThereForVeterans.com. And we're asking communities to make a commitment using this pledge on the left about specific action steps communities can take to be part of the solution in reducing veteran suicide. As I mentioned earlier, the President has signed an executive order for veterans that are, or service members that are leaving service so they can have mental health benefits. We know the very highest incidence of suicide is those first 12 months after you leave the service. That's the single highest rate of suicide. The highest number of veterans are older veterans who take their life, but the highest incidence is that first 12 months, and that's why we're offering this mental health benefit as part of this executive order. We also do know that the opioid issue, the addiction that I know so many of you are focused on, is part of this issue with veteran suicide. Because of that, we've undertaken an opioid safety initiative at VA. We've reduced the number of opioid prescriptions by 41% in the last 4.5 years. But we also now are the only system in the country that publicly posts its opioid prescribing rates. So if you go to the VA website, data.va.gov, you can see where your local community and your local VA is in terms of its prescribing rates of opioids and what they may be doing either better or need to do to be able to try to maximize who benefits and who does potentially be harmed through these prescribing practices. We're also working with you to decrease and to end veterans' homelessness. We know that veterans' homelessness is again, a higher incidence of veteran suicide, people who do not have access to services and don't have social support around them. We've had close to a 50% reduction in veteran homelessness in the past 5 years, but we still have 45,000 homeless veterans across this country. And so we're trying to work closely with local governments to find solutions. We're obviously doing this also at the federal level with the Department of Housing, Urban Development. One of the first decisions I made as secretary was to extend mental health benefits to other than honorable discharges. 15% of all people discharged from the service end up with a other than honorable discharge, not a dishonorable discharge, but other than honorable, which may often be related to a behavioral health issue or a substance abuse issue. We think they need treatment. We think they're at risk for suicide, and that's why we took those steps to be able to get them the help that they need as well. And finally, let me just end by letting you know that we're working now with Congress to implement the President's budget for 2019. It is a strong budget for veterans. It reflects the President's commitment to improving services and care for veterans. It's close to a $200 billion request. It adds money for things that we've talked about, like mental health and homelessness. It also reflects an investment back into the VA, as well as expanding the options of choice for veterans in the community. So we think it's the right thing, and we're working hard to make sure that that becomes a reality. I appreciate the time that you've given me this morning, and thank you again for everything that you do on behalf of our veterans. Thank you very much.